includes both our clinics, state clinics, and GPs and pharmacists. So today we've got a couple of announcements about really pushing forward, particularly ahead of the school year beginning, to get our 5 to 11-year-olds through their first dose. That's very important. And Naomi Bromley joins us, Deputy Secretary of the Department of Health, and she'll speak in more detail to that. But I'll come to those announcements in broad terms in just a moment. There's something like 15,500 kids that are booked in to receive their first dose over the next 7 days, and we thank them and thank their mums and dads for making those appointments. But there are something like nearly 82,000 appointments that are available over the next 30 days. So please go online, make that booking, protect your child, and in the same way protect both your family and every single Victorian family. These numbers are strong, they're building, but we really do need to do even better. In terms of third dose, more broadly, 67,000 people aged 18 plus currently are booked in currently to receive their third dose over the next 7 days. 217,300 third dose appointments, however, are available. So as impressive as this gradual building is, we have got nearly 220,000 appointments that don't have someone's name beside them. Please go online, please do this for yourself, for everyone, and please do it in good time. And again, we have some further announcements about making that process even easier, even more localised than it's ever been. More than 2.3 million Victorians are currently eligible for a third dose and haven't had that third dose. So again, as impressive as the gradual building is, there are more people who are eligible and have not had the third dose than those who have. And we just appeal to people, please make the best choice for you and your family. This is not a 2-dose thing, 2 doses and a bonus. It really is international evidence, our own experience, the views of experts, and hopefully the confirmation of both the Target and National Cabinet today will mean that everyone knows and understands that this is a 3-dose project, and it's only with those 3 doses that you can hope to be properly protected against serious illness, minimising your likelihood of transmitting this virus, and of course basically positioning us as well as possible ahead of whatever's next to hit us, whatever variant's coming down the track. 3 doses is critically important to that. Now, just the numbers of the day in terms of the usual things that we report to you on. 1,057 Victorians are in hospital, 117 of those are in ICU, 40 of those are on a ventilator. I'm sad to have to report that 15 Victorians with COVID have passed away, and we of course send our best wishes and our sincere condolences to their families. This will be an incredibly difficult time for them. In terms of case numbers, 7,625 self-reported RATs, a further 6,130 laboratory confirmed PCR positives, and that gives us a new case total of 13,755 additional positive cases. I'm afraid I don't have a total PCR test number for you. Naomi may, if she doesn't, we'll get you one before too long, but I don't have that for you at this stage. That means our total active case numbers 119,153. That's still very significant, but you can see the trend is with us. The trend is on a much more positive trajectory than we had perhaps thought, and indeed some of the modelling had shown us. That doesn't mean we can be complacent. We've still got to go into ISO when the rules require us to. We've still got to get tested when we think we've come in contact with someone who's positive or we've got symptoms, and we still need to go and get vaccinated. The third dose has never been more important, and paediatric vaccines, well, we all know, particularly as we push towards the first day of school, day 1, term 1, there's still every reason to go and get our kids vaccinated and begin the journey. 1 dose is not the end for them, but you can't complete that journey. You can't get the protection of a safe, free and effective COVID-19 vaccine for our younger Victorians. You can't complete that journey unless you start it. So the first dose is incredibly important. And thanks to all those parents who've taken their kids along, thanks to all those Victorians who've had a third dose, I just again appeal to all Victorians. It's never been easier. There's more appointments, there's more vaccine. We're doing lots of innovative things to take the vaccination program to you and to your local community. Please go and get vaccinated. your third dose is not a bonus, it's absolutely critical and essential to you being protected against critical illness. And we see some really scary statistics today published about just how many people who are fully protected with 3 doses, and even those who are fully protected with 2, they're not the people who are passing away in our hospitals. It is in an absolute majority of cases, it is those who are not protected by COVID-19 vaccine who are dying. Now, I'm not for a moment suggesting that people didn't have other conditions. It can be a whole range of different reasons. But these vaccines save lives. Getting vaccinated vastly reduces your likelihood of finishing up in hospital, let alone finishing up in critical care with your family having to attend a funeral. So for yourself, for the people who love you, for all of us, please go and get your third dose. And if you haven't had a first dose yet, well, there's plenty of those appointments available too. Victorians have done an amazing thing, a remarkable thing, to be mid-90s almost, 90% double dose covered. We're one of the most vaccinated communities anywhere in the world. We've just got to make sure that, just as we did so well with first and second doses, we've got to do equally well into the 90s on third doses in order to lock in all of that special achievement. Now, to that end, I'm very pleased to be able to confirm for you. You remember just a few weeks ago we talked about pop-up vaccination clinics in our schools, in a number of schools. The first 15 of 30, so 15 this weekend, 15 the following weekend. Naomi's going to take you through a list of those schools. They are targeted towards communities where we perhaps, at some point during the vaccination program last year, we had slightly lower vaccination levels than we would have liked. They've all caught up, they've all got to that above 90% number now, but for a whole range of different reasons, it's I think smart for us to make access even easier in those local communities. Now the schools will advertise, the schools will push all that detail out. It's not just for students, it's for staff, it's for parents, it's for people who live in that local community. It's about using the fact that the school is well known, has fantastic facilities, is a trusted environment to make sure that people really close to home, where it's as easy as it possibly can be, people can access the third dose or indeed paediatric vaccine where that's relevant. Also, on top of that, you would also recall that we indicated we would have another round of grants to support our partnerships between community pharmacy and the Victorian Government and GP practices and the Victorian Government. Those business people, they're running businesses, they're not running necessarily a vax hub. To do so can mean they incur additional costs. So we had grants last year for that. We've added to that now with a grant program that's all about having partnerships between schools and pharmacists, partnerships between schools and GPs for them to do in-reach, if you like, for them to bring what they do, their primary care vaccine program, into those school communities. We've got some more to say about that as well, so that's fantastic. Both pop-ups, making this as local as it possibly can be, but also really strong partnerships around our kids, particularly in that lead up, that last push before we finish up with kids back at school later this week, early next week. So I'm going to ask Naomi to speak to all the details of all of that, but the message is a very simple one. Thank you to everybody who's had a third dose or booked an appointment for a third dose or is planning today to go to one of our walk-up sites. Thank you to every parent who has made an appointment or has gone and got their kids vaccinated. Thanks to those young Victorians too for the part that they're playing to keep you out of hospital, to keep you safe, to keep you alive and well. Please go and get a third dose. There's never been more appointments. There are walk-ups available. It's critically important. Critically important. We can't be at 35%. We've got to be at 95%. Otherwise, we run the risk that the protection that we've been enjoying at the moment, in a broader sense, there are people in ICU and we send our best wishes to them. We know they're getting the best of care. But in the broadest context, we've not seen thousands and thousands and thousands of people in critical care with machines needed to help them breathe. That's because of these vaccines. A third dose is just as important as the first and the second. So I commend that to everybody and just say we're doing innovative things that no other part of the country is doing to bring the vaccine program to you, but we need you to turn up and be part of it. I'll now ask Naomi, who and her team are doing a fantastic job rolling these vaccines out. She can speak a little bit more detail to these school-based initiatives that are rolling out from this weekend.
Thank you, Premier. I'm just going to speak really quickly to testing. We did have 32 sites that were closed yesterday due to heat. We have had a few disruptions this morning as a result of some of the storm activity, but the testing system is getting back to normal after that, those weather activities. And we are seeing a turnaround we are seeing improvements in the turnaround times as well. They're continuing to stabilise, with 93% of PCR tests now being returned the next day. As the Premier said, more than 1.8 million Victorians have now had their third dose. Now, in terms of the age group, the age breakdown of people who have had that third dose, 60% of people aged 70 and above have now had a third dose. That's great, but obviously we want it to be even higher, particularly for those older Victorians. 50% of people in their 60s, 45% of people in their 50s, 42% of people in their 40s, 21% of people in their 30s, and 12% of people aged between 18 and 29. As the Premier said, there are currently 219,000 bookings available for people aged 12 and above through the state sites over the next 30 days, and they're for first, second and third doses, remembering that third doses are currently only available for people aged 18 and above, and for those who are more than 3 months from their second dose. It's really good to see such strong uptake of our paediatric vaccines for 5 to 11-year-olds. We're very pleased to see those numbers continuing to increase every day, and also to get such positive feedback from the kids and families that are coming forward and having really positive experiences when they do come forward. We do hope that by the end of next month, for children aged 5 to 11, we will have the majority, perhaps up to 90%, will have had their first dose, and we're really keen to see that number go as high and as fast as we possibly can, particularly as kids go back to school. There's still plenty of opportunity to get vaccinated even before school starts for most kids on Monday, even if you haven't been able to make an appointment yet. So there are 81,000 appointments available for 5 to 11-year-olds in the next 30 days, and many more through primary care, of course. But there are actually plenty of appointments, 12,426, available in the state system before school starts. So sites with the most appointments available today, as of this morning: Melton Indoor Vaccination Centre, the former Bunnings, 1,300 appointments; the Royal Exhibition Buildings, 1,200 appointments; Caroline Springs Leisure Centre, 1,200 appointments; Sandown Racecourse, 1,200 appointments; Campbellfield Ford Factory, 800 appointments; Cranbourne Turf Club, 660; Sunshine Hospital, 600; Co-Health West Melbourne, 437. And particular shout out in regional Victoria, some places with a lot of availability before school starts: Shepparton Showgrounds with nearly 900 appointments, and the Geelong Ford Factory with just over 400 appointments. So families can call the call centre or go online and book into one of those appointments before the end of Sunday. And that's in addition to the many appointments available in GPs and pharmacies, and of course the many, many families who already have bookings in place. If you can't make an appointment but you still want to get your child vaccinated before school starts, we do have some limited walk-ups available for 5 to 11-year-olds this weekend at some sites, not all sites. So Sandown Racecourse, Dandenong Plaza, Caroline Springs Leisure Centre, Campbellfield Ford Complex, Sunshine Hospital, and the Melton Vaccination Hub. If you think you might want to do a walk-up, I really recommend going online, checking those sites, checking the times that they're accepting walk-ups. It's mostly from 9 till 4, Saturday and Sunday, and also quickly checking the wait times. But we really encourage families to get it done this weekend if you possibly can. This weekend, as the Premier said, there'll also be a range of school pop-ups starting. We've got 15 running this weekend. They are available for students of those schools, but also other students in that local area, Also, kindergarten kids who might be 5 years old can go along to one of these schools. Their parents can get their boosters, they can take their grandparents to get their booster. They really are a fantastic opportunity for a local community to get involved in a really localised vaccination effort. And the schools for this weekend are Kensington Primary School, the Moe Albert Street Primary School, Roxburgh Homestead Primary School, Lilydale Primary School, Glen Waverley Primary School, Cranbourne West Primary School, Fountain Gate Primary School, Lindale Greens Primary School, Bellevue Park Primary School, Glengala Primary School, Harley Park, Movell Primary School, St Albans East Primary School, Wyndham Vale and South Melbourne Primary School. And we really thank those schools who are getting ready for their pop-up right now, and the local healthcare providers that will be going along to make those vaccinations available to those kids and those communities. Most of these sites will be themed up as our Enchanted Forest of Protection theme, and we really look forward to seeing those kids come forward for a fantastic experience.
Thanks very much, Naomi. Just before we go to questions, I neglected to mention there'll be an emergency services EMV briefing later on today, I think around 2 p.m, just in relation to storm and flood activity overnight. I did want to give a shout out. It's always risky when you give a shout out to one part of the state, but Mildura had a pretty rough night in terms of flooding and some storm damage, and I know that local SES crews responded to around 126 call-outs. So that's an amazing effort. Thanks to each and every one of them, and I'm sure all of us send our best wishes to that community. And of course a general thank you to all of our emergency services, and particularly our SES volunteers. They do an amazing job every day, but last night was pretty challenging, and no doubt there'll be further of those challenges over the next few days with some of the forecast pretty challenging weather. Happy to take any questions you have.
Is there any update on elective surgery and whether any more surgeries can resume? I spoke with the mum of a 6-year-old who has a club foot, and the 6-year-old told me the other day that she just can't keep up with her friends. She can't run and keep up with her friends. So what do
we want everyone who's scheduled for surgery to get that surgery as fast as possible. It's why we have over all of our time in office, we have prioritised getting more surgery done, boosting funding, opening new hospitals, new theatres, helping to train new staff, all of those things. That's our record, that's what's most important. It is incredibly painful and distressing and challenging for patients who have their surgery delayed. I'd also just make the point that nobody in government, whether it be officials and health experts who are advising the government or members of the government, none of us want to have to make those incredibly difficult choices to cancel services, to mean that people have to wait longer. Not only will we get these services back as fast as we can, just as we've done every time we've had to close down parts of the system based on advice, based on safety, there'll be a big effort to catch up, a really big effort to catch up. But that's exactly right, there will be a blitz. There's been several blitzes over the period of time that the pandemic has impacted. We were doing big and important things in elective surgery, and we want to get back to that. We want every single patient to go to get the care they need as fast as possible, as close to home as possible. Everyone, I think, appreciates that this is a global pandemic. These decisions are not made lightly. They're very difficult for patients, and they get made based on detailed consideration and advice. And as soon as I'm able to get those services back up and running again, absolutely we will, and we'll try and do as much as we can, as fast as we can, to catch up.
What is the threshold, the pressure point that would allow more things to come online, and when is that likely to come? I know that they're reviewing code brown every single day.
It is reviewed every day.
Yeah. When is the threshold that could allow given IVF regime?
There's every procedure, every type of procedure, every part of the hospital system is judged on its merits, on the challenges it's facing, on the challenges it might face. You make assumptions, they're replaced by what actually happens each and every day. That's why you have it reviewed every single day. If we see these numbers continue, if we continue to see hospitalisation falling, certainly stability there, if we continue to see case numbers falling, I'm not here to call the peak, that's a matter for experts, but I was talking to the Chief Health Officer yesterday and it would seem that there are some very positive signs that perhaps we've reached that peak. But that doesn't mean it's over. Omicron is still with us and we still have to go and do the ISO when the rules require that. We still have to go and get our booster shot, our third dose. We still have to get our kids vaccinated. We still have to follow the few rules that we have. We still have to do our very best to follow those rules every single day. When I get advice that says the code brown can come off, that's exactly what will happen, and we will resume surgery and all other services as quickly as we can, and then we will do everything we can, just as we have in the past, to catch up and make sure that that all of our patients are getting the care that they need. This is not. I just want to stress, because the facts are important, and I know that no parent, no patient is interested in political games, but there are from time to time. There's a bit of mischief made here. The facts are these. This is not about money. This is not about machines. It's not about beds. It's about people. If you've literally got thousands and thousands and thousands of staff, nurses, paramedics, doctors, the whole team, if you've got thousands and thousands of those people at home because of COVID, they obviously can't be at work, in the operating theatre, or on the ward, providing you with the surgery that you were listed to get. That will change. We're already seeing some of those furloughed numbers coming down. Just a long way of saying, as soon as we can get these services back up and running, we will, and we'll do everything we can, as fast as we can, to make up the lost time.
Can we expect after National Cabinet?
And to be honest, Simon, it's not a hard and fast hour X on day Y.
No, but I know it was 4,000 a couple of days ago.
Oh,
I think it's come down to 2 just on yesterday's COVID update.
Mid twos.
So yeah. My point is, we're seeing that staff furloughing start to come away. So
yes, we are.
That's why I'm asking. You know, is there a trigger point with that?
No, it's not. It's not
that specific.
What I'm saying to you is, we've got a trend. The trend is with us. It's more positive than we thought. If that's maintained, then it won't just be a trend. It'll be, it'll be a situation where we can take the code brown off and we can get services back on. Everyone across Victoria, please be in no doubt, that will occur as soon as it possibly can. These changes, these disruptions will not be in place for a moment longer than they need to be, and not in my judgment, in the judgment of health experts, clinicians, and those who provide us with advice to make very difficult calls. No one enjoys this, least of all patients, of course. We'll get these services back up and running and then boost them, then try and blitz and catch up very soon thereafter.
After National Cabinet, do you expect we'll have agreement on 3 doses being the definition of fully vaccinated?
I certainly hope so. I think this is where we're heading. I think everyone can see that and understand that, whether it's the international evidence, our own evidence, those statistics that were published today in relation to those who are passing away. And again, we're not here to criticise any of those people or make judgments. It's a difficult enough time as it is. But in a more positive sense, the data supports what we've always said. If you are vaccinated, and particularly if you've got 3 doses, you've got the greatest protection you can possibly have against being critically ill if you get this wildly infectious Omicron variant.
When can we expect an announcement from you on whether that boost will be mandated?
Well, I think if you look at the sequence of this, first of all, it would be obviously preferable if we get a target position, National Cabinet notes that position, it's then confirmed at that national level. This is not 2 and a bonus, it's 3. And then we may well, via the process of the new Act, we may well add to the list of people, of groups of people within our community who must go and get a 3rd dose. We've already got a significant list of different parts of the Victorian economy, and of course the Deputy Premier and Education Minister added teachers and staff to that list earlier this week.
Do you anticipate that fully
Everyone will get the go. Rich?
Do you expect the fully vaccinated status to apply going to the pub, going to the theatre, go to sport. Is that?
I think there's a very strong argument for that. There's a very strong argument for that. Let's just get the sequence of this right. And I am conscious of the fact that these powers are not vested with me, they're vested with the Minister through a process under the new Public Health and the pandemic-specific management provisions of that Public Health and Wellbeing Act. So I don't want to cut across that, but I think there's a very powerful argument. Let's be in no doubt, despite some of the mischief and the games that are played, pretty cheap games, around mandates, we would not have got to 93% double dose without the difficult decisions that were made and the amazing performance of the Victorian community. If it was logical to mandate in certain settings for dose 1 and dose 2, well, I don't see any reason why you wouldn't. In fact, there's a very compelling argument that you would mandate for dose 3, particularly if the experts, as I think is imminent, very, very soon, I think we're going to get the experts saying, as I've been saying, because our experts have been advising me, this is not 2 and a bonus, 2 and an optional, it's 3.
You've had that discussion, you've talked a lot about your relationship with Dr. Arizona. Have you had this discussion with him?
On the vaccinated economy, we have, look, we've tried to have settings that are as close as we can, to work together as close as we can. I would speak to him each week, usually. Officers and departments speak more often than that. I had a lengthy conversation with him, I think, on Monday night. They've got different vaccinated economy settings to us. That's a choice they've made. We think this works for us, and again, notwithstanding the process that has to be gone through, I see no reason why we won't add to the groups within the community that have to get the 3rd dose. And then, ultimately, people want that to mean something. People want their 3-dose status to mean something. And people, I think, have a very dim view, of those who just refuse to get vaccinated against all the logic, all the science, all the evidence, all the tragedy. These vaccines work. They're free, they're safe, they're effective, and they, for many, are a must.
How soon after a National Cabinet decision would you make an announcement about the mandate? How soon would it take, given the processes?
I couldn't. Well, let's just wait and see. Let's not get ahead of ourselves. But it's not like it's going to be not going to be the following day.
This time last week, you said you're hoping the 3-dose as fully vaccinated issue would be resolved in National Cabinet. Was there a delay, or were there some states that were more reticent, or why?
No. I think that's a good question. I think ATAGI and other bodies are busy. We've got lots on. I wouldn't read anything into it other than they've got lots on. But again, when I talk to our public health team and our hospitals team, they say to me, this is a 3-dose thing. It's not some bonus. It's not an option. We all need to get 3 doses, as I have, as Kath has, as our kids will when ultimately we start doing 3rd doses for the younger Victorians. I think that there was some expectation that we'd get confirmation at last week's meeting. That didn't happen. That isn't an issue. No one's upset about that. Don't read anything into that. Hopefully we get that confirmation today.
Just touched on it there for 12 to 15-year-olds. Will you have that discussion about boosters for them at National Cabinet Day? When can we expect that?
I'm not sure when that will be. Oh, sorry, there has been some discussion. I'd probably direct you to General Fruit around that, or perhaps ATAGI before then. There's been some decisions that have been made, but this has been done in an orderly way. It's been rolled out progressively. We'll get to 3rd doses for our kind of teenagers or young adults when the relevant approvals are made and when we get to that part of the program. This has been rolled out well. We haven't got some of the supply, really any of the supply problems we had last year. We've just got to make sure that people turn up as they did last year in amazing record numbers to get protected.
And
what are you pushing?
On rapid tests, how many have been delivered to schools ahead of school starting? Either 2 schools or how many in total?
Sure, I had a briefing last night about those matters in very broad terms, so I can't give you a number, but I'm happy to try and get you an update. Whether it's, as I'm advised, whether it's air filters, purifiers, rat tests, all that's going well. It's going as we hoped. Let me try and get you a more detailed
So they have
update.
started to be delivered?
As I understand it, they're certainly into. Well, let me get you the update. It's moving pretty fast. They were going out to central points, then they'd be distributed from those points. That's been happening all week. Let me get you an update.
What else are you pushing for at National Cabinet today? I understand So there's an update on health system capacity, vaccine rollout and supply chains. Is Victoria taking any positions into that you need support from the other states on?
So every National Cabinet meeting receives those 3 updates and a couple of other standing items, so we'll go through those again today. That'll give us a picture of what's occurring across the country. It's also an important opportunity for public health officials, national public health officials, to give us a bit of a sense of what's happening in our region, what's happening in the rest of the world. Today's not really a meeting for to be pushing things, it's more about updates, and we'll, I don't think it'll be a very long meeting. We're all very busy and we're all focused on delivering on the principles and the broad plan that we have agreed to at National Cabinet. But let's wait and see how the meeting unfolds.
You just mentioned that National Cabinet's been waiting for a tardy advice on that 3rd dose. There have been a number of occasions during the course of the pandemic where there was a wait for advice either from the TGA or a tardy before we could get on and do things like get vaccines out to people.
Yes.
Even though there were precedents all over the world of these things, you know, being obviously demonstrated to be safe.
Yes.
Are you frustrated by the pace at which those 2 bodies have taken to do their work?
No. I think you've heard me say many times, because I mean it, and it's true. TGA approvals in this country, I think, are worth more because they take a bit longer. I think there is something we can be comforted by the fact that there's a big team of people who take their responsibilities very seriously. You know, it's a bit like, you know, I've heard a bit of talk about rapid antigen tests and a few political games. You know, there's a whole bunch of rat tests that were available last year that have now not been approved by the TGA. Probably a good thing they haven't got a warehouse full of them, eh? You know, so they do their job properly. They do their job well. In terms of ATAGI, they've got some really challenging responsibilities as well. You all know Alan Cheng, fantastic Victorian. Great Victorian. He and the others who sit on that particular advisory group, they work through things diligently. I'm not frustrated. I'm in fact comforted by the fact that they take their job very seriously. But hopefully we get confirmation soon that, as I said, this is not 2 plus a bonus, 2 plus an optional. It's 3.
Will that fully vaccinated mandate apply potentially to customers and patrons, so people going into cafes or people going to shops? Because that doesn't apply at the moment, as far as I understand.
Well, retail certainly doesn't apply. Again, I don't want to pretend to make those announcements today. If and when that's the position, there'll be a full account of all of those measures, what that means for people across the board. I think it's important though that people can safely assume that this would be a continuation of the current settings. It won't be that there'll be a whole new area that we try and cover. As it stands now, if you're not double-dosed vaccinated, there's a whole range of things that you can't participate in. That's a choice that you have made. It's the wrong choice, and it puts at risk the health of others. It just makes sense to me that if that's good for 2 doses, and the experts tell us that 3 doses really is critically important, then those rules would logically apply for 3 doses. That's not done yet. When it is done, we'll have a lengthy press conference, I'm sure, talk to you about all of those issues, but I think it's fair to assume that it would be very similar. It'll just be where 2 was to get your green tick, it'll be 3.
Just on QR codes,
Yes.
obviously they're being used to check vaccination status of venues. Are they being used in order for contact tracing purposes?
There's not very much contact tracing going on at the moment, simply on the basis. I'm happy to get any details for you from the department. There might be some very limited circumstances where we would use that information for contact tracing. Very limited circumstances. I think when you've got as many cases as we've got, and you're up against a variant that's as that's as widely infectious and as easily transmitted as Omicron, we're kind of well beyond outbreaks and we're well beyond contact tracing as such. Other than the contact tracing that's done by each of us, if we get a positive, we of course, I'd like to think, I think it is happening, and I'd certainly encourage people to talk to family and friends, talk to people you've been with, so that they can do everything they can to keep themselves safe. Not that I've been briefed on. I think that it's one of those kind of cultural things. You know, we've spoken for a very long time commending to people to go and get tested, and that's why, for a long time we had very big queues at PCR testing sites because people were doing exactly what we had asked them to do for a couple of years. We've now got a slightly different testing system. Those RAT tests, the supply which is growing every single day, every single week, means that it's slightly different and it takes time to adjust. I think people, this is an easy thing, check in, it's very important. Ultimately, I think the general mood across the place is people don't want to be sitting next to someone who has not done what they've done, and that is gone and got vaccinated for themselves and for everyone. It's a very generous thing. It's very personal, and you derive great benefit personally, but it's a very generous thing to go and get vaccinated, not just for yourself, but for everybody, not least of which for the people we count on every day, our nurses, our ambos, our doctors, the whole health team. Getting vaccinated helps them because it takes pressure off the system. For every good reason, please go and get a third dose. Get your kids vaccinated. If you haven't had a first dose yet, it's not too late. In fact, it's never been more important.
Rachel.
Oh, sorry. We've got one more and then Rachel.
Sorry, just one more.
Sure.
Given what you just said, it sounds like they're going to be used in Victoria for many months to come. Something the DBologists are saying that maybe instead they should be used in just high-risk settings, like a hairdresser or a nightclub. Would you look at changing the way we're using and checking it?
As it stands, I've had a conversation with a number of colleagues about this. The settings, I would note, the settings will be there for as long as we have advice that supports them. And I would note that just this week, New South Wales have extended their settings, which are pretty well identical from a QR code point of view, for another month. So these things are not going to be there forever, but they'll be there for as long as the experts tell us they serve a purpose, they're useful, they're important, and it's sad that we've got to have all these elaborate systems to keep people out who have made the wrong choice. I wish people would just go and get vaccinated. I don't, however, want the decisions of a small number of people to detract in any way from the amazing job that more than 9 in 10 Victorians have done. It's very, very special. We've just got to get the third dose done now. Going to
So
Rachel.
you're essentially saying that the QR code system is remaining in place to police the vaccine mandate rather than the contact tracing?
Yeah, I don't think that's new. The other thing too, though, is we all wish this was done, dusted, and over, and we could sort of return to something approaching normality. I don't know what the next variant is. I don't know what this looks like in 3 months or 4 months. Like, these are uncertain times. That's why everyone playing their part, but also clarity around where the government stands. We stand for getting vaccinated. And for some people, that's not a choice. We will mandate that. We will ensure that you play your part. Once you've got a vaccinated economy, and I make no apologies for that whatsoever, not now, not ever, a mechanism to deliver that, a mechanism to make sure that when you go to the restaurant, you can have the confidence that everybody around you and everybody who's serving you has done what you've done, gone and got vaccinated for themselves, but for everybody. That's that point. Deeply personal, very, very big benefit for you, but a particularly generous thing for everybody else as well. And that's why we ask everyone to do it, and that's why we require some to.
If all the system is being used for is to confirm people's vaccination status, why are we still collecting information on where people are going?
Well, there'll be. It's very important though, just to be clear here. And when you say we are collecting information, it's no different. It's no different than it was last year or the year before. The law has been further tightened about the uses and purposes of that data. I think we run probably the most safe and secure system anywhere in the country. I won't give you a league ladder of others, but I think that Victorians can be confident. And the other thing too, that it's used for the purposes it's intended to, and that's to keep people safe, and no other purposes. The other point too is, again, back to the issue I raised a moment ago. None of us know what's coming. None of us know what's around the corner. I don't say that to alarm people. That's just the fact of it. If you asked me before Christmas about this new variant, then we probably would have had a different view about what January and February would look like. Let's hope that the early signs that we've hit the peak are accurate. Let's hope that that means these hospitalisations continue to decline. And then let's hope we can have that code brown off and things like elective surgery back to normal, and indeed under blitz conditions to try and catch up and make up for the time that we've lost.
Just on that issue of looking to the future, I'm certainly not saying we're there yet, but can you foresee a time where we treat COVID essentially as an endemic disease like we do before?
Yes, but the only way we'll get to that is if we've got the protection of a community-wide vaccine program that at this stage is 2 doses. I think it will very soon be 3 doses to get the green tick. Who knows what comes after that? We've seen winter is a very challenging time. The other thing to remember, so what we do now will have a direct bearing on what things look like and how much pressure and how much challenge we have to face then. But just think about this for a moment. We haven't had flu in this country for a couple of years. Our borders are open now. We've got people travelling. We've got a lot of respiratory illness that's not COVID at the moment. Any GP will tell you that. Certainly our emergency department nurses and doctors and ambos can tell you that. But think about the winter ahead, where there's every chance we have flu. There's every chance, well, almost certainly we're going to have COVID in one form or another. We've not had that mix before. So, you know, getting vaccinated is incredibly important, and getting vaccinated is the key to treating this as an endemic, as something we just have to deal with each and every year, a bit like the seasonal flu. At the moment, though, without vaccination, this is not the seasonal flu. This would take out thousands, tens of thousands more people than the seasonal flu does. There's some very disingenuous and frankly quite dangerous comparisons that are drawn between by some, I think, extreme commentators about the seasonal flu. This is not the seasonal flu. It'll get to the point where it's endemic, where it's it is, as we've always said, it's normalised, but we're not to that point yet, as you rightly pointed.
Just on the situation.
You're very shouty today, aren't you? I'm not shouting at you, so let's just go on quietly, and we'll be here forever. We'll be here for a while, and then we'll head off to National Cabinet. Simon.
Thanks, Premier. Just on the situation at the store involving the disability home,
yes,
has been granted an exemption,
yes,
for the positive workers that have tested positive to COVID.
Yep.
Can I just confirm that there is, from your understanding, I know Jerome said yesterday there wasn't, but there is no other arrangement in place so far, or exemption in place for those that are currently positive to go back to work?
I don't believe. The only exemption that I'm briefed on is that one.
Yep.
I know the union has been a bit upset about this. We didn't consult them. Well, I think we're probably a bit more focused on providing care to people, right? You know, there's a group of residents, they're positive. There's a group of staff, they're positive. Let me say thank you to the staff, not just for this work, but the work they do every day. And thank you to those residents and to management. Everybody's doing their best. Everybody's, you know, stepping up and trying to provide the best care and the best support in completely unique circumstances. This is not a government-run facility. We are not responsible for recruiting or replacing these staff. This is not a choice you'd like to make, but ultimately this was the only choice that could be made in order to guarantee that those residents had continuing care. And if the union's upset about that, well, I'm not too upset about doing whatever we can to provide the best care to people we possibly can. It's not ideal, it's not perfect, nothing is.
If I may, I spoke to the union yesterday, just to get their point of view across to you. They were just concerned that this would be the default policy going forward, that if a sector went down, it was just, so to speak, that term in terms of staff, that would be a policy going forward. Is it not? Is it a case of what?
Of course it is. That's the nature of exemptions. It's not a blanket policy. Like, this is the thing. Quite the contrary. It's an exemption-based process. So it's not a blanket rule. I would have thought that was self-evident. This is not a blanket rule. You need to get an exemption, which then means there would need to be an examination, a consideration of the individual circumstances. Look, I'm not being critical of the union. They want the best outcomes for patients, for clients, for residents and for staff. So do I. This is unique, it's challenging, nothing about this is easy. But I would hold up our record over these last couple of years in disability settings against any record across the country where there's been significant virus. But I do take this opportunity to thank staff and to thank residents and their families. This has been really challenging, really challenging. We've done everything from stepping in to try and support staff, to taking the vaccination program into these sorts of facilities. We've been very focused on the best outcomes for some of the most vulnerable in our Victorian community, and that won't change.
I mean, one of my colleagues is super keen for me to ask you a question about schools and not to do with COVID.
Right.
The City of Wyndham is calling for more government schools in their LGA. It's a booming population, as you know. And it says the current plans to build schools in the area don't go far enough.
Well, they're entitled to their view. That the facts of the matter are that whether it's in Wyndham or any growing community across our city and state, no government in the history of our state has built more new schools. No government in the history of our state has built more new schools in growing communities or upgraded more existing schools in growing communities than our government. But we know there's more that has to be done. That's why an agenda to keep building schools rather than closing them, to keep boosting education funding rather than cutting it, is so important, and that will be on the ballot at the end of this year. Then of course we could talk about TAFE, which is just as important, so that every Victorian can get the skills they need for the job they want. We know what was done to TAFE. We've repaired that damage, now we want to make TAFE better than it's ever been. So whether it's kinder, 3-year-old kinder, massive boost. Primary schools, secondary schools, TAFE, there's a massive agenda here. But that work will never be done. There'll always be a need for a strong Labor government that values education and gets the job done when it comes to building the infrastructure we need. That work is there every day, every year, and it will be on the ballot at the end of this year.
Premier, did you and your family manage to dodge COVID over the Christmas break?
Yes, we did, but now that you've asked me that question and I've answered it, we're almost certain to finish up with it next week or something. But notwithstanding that, I shouldn't be flippant, but no, there's been a few tests and there's been a few days away waiting for test results back when it was more PCR dominated. But no, we've not had any positive diagnosis in the house, and let's hope that continues. I'll thank Sky for their interest and their best wishes.
Did you yourself have to, can I just ask if you wouldn't mind, did you yourself have to wait a few days for a test result?
I think I waited about a day. That was back before Christmas. That was before it got really busy, I think.
Yeah.
It still was busy, but it wasn't.
But your family members had to wait a few days?
Yeah, they had to wait. Yes, I think Gracie waited quite a few days at one point, but had done a whole bunch of RAT tests, which we had purchased ourselves. Not me, I didn't do the purchasing. I think Catherine did.
I didn't ask.
Good. I've just been clear. It's been really clear, as clear as I can. But anyway, this is going in no good direction. Got any other questions?
Just quickly on the earlier topic, how confident are you, as much as you can be, that this is as bad as things are going to get moving into the future in terms of...
You're asking me to make... look, I can do the old hope over experience if you want, but what I'd say is this. All we can do is follow the science and the logic and the best advice to try and make really uncertain times a little easier, a little bit better. So we stick with the things we know, the things that can't really be argued against. If we isolate when we're supposed to, there'll be less cases. If we have 2 RAT tests a week for everyone in our schools, we'll have less cases. If we all go and get our 3rd dose when we're eligible, we'll have less cases. That's what we know. That's what we know works. If we stick together and help out and do our best and look out for each other, things will be better. There's no question about that. It's really pleasing to see some of the data about people sort of self-regulating at home less, people getting out and about more, school next week is fantastic. It'll be challenging. I don't think I got a chance on Monday to necessarily put this on the record, but look, it'll be messy, it'll be challenging, it'll be difficult. Nothing about that's going to be easy, but it's infinitely better than having all of our kids at home and therefore so many of their parents at home. Think about the impact on the economy, think about the impact on our kids. So, you know, that'll be challenging, but we've got to stick to the things we know work. I can't give you a prediction, not one that was grounded in evidence, about what the next 2, 3, 4, 5, 6 months looks like. We're just going to have to wait and see. But sticking together, sticking with the science, working hard, and looking out for each other, and together we can do anything. That's what Victorians have shown, and we want to continue to lead our state in that way. All good? No other issues? Thanks so much. Have a good day.